Now, diagnostic ultrasound is a powerful imaging tool that uses high frequency sound waves to create images of soft tissues, muscles, tendons, ligaments, and joints. Unlike other imaging techniques such as X-rays or MRIs, ultrasound provides real-time dynamic imaging, which makes it incredibly valuable for sports therapists. How does diagnostic ultrasound work? So it uses sound waves that bounces off tissues and structures within the body to produce real-time imaging. A handheld device called a transducer is placed on the skin, which sends sound waves into the body and receives the echoes that bounce back, creating detailed imaging. Now, ultrasound does not involve radiation, making it safe, non-invasive, and repeatable imaging option. Now, the use of diagnostic ultrasound in sports therapy. So, assessing soft tissue injuries. So, this is particularly effective for visualizing soft tissues such as muscles, tendons, and ligaments. Sports therapists can use ultrasound to assess common sports injuries like muscle strains, tendon tears, and ligament injuries. So, for example, it can help look at partial or full tears in the Achilles tendon or rotator cuff injuries in the shoulder. It's real-time dynamic imaging. So one of the key advantages of diagnostic ultrasound is its ability to provide real-time imaging, allowing the therapist to assess dynamic movements and function. Now, this is particularly useful in sports therapy as it enables the therapist to evaluate how an injury behaves during motion, helping to identify specific causes of pain or dysfunction. So, for example, diagnostic ultrasound can show how a muscle or tendon behaves during movement, making it easier to pinpoint issues such as impingement or tendon snapping. Now, diagnostic ultrasound can also be used in guiding treatment. Even though sports therapists are not qualified in guiding or using needles, it can be used in assisting needle injections or help with dry needling treatments. So it means that the diagnostic ultrasound can be used to precisely guide the placement of an injection for tendon injuries, ensuring the treatment is delivered directly to the injured site. It can monitor healing process. So diagnostic ultrasound can be used to monitor the healing process of soft tissue injuries over time. Therapists can track improvements in tissue structure or identify any potential complications, allowing them to adjust the rehabilitation plan if needed. So, for example, a therapist might use diagnostic ultrasound to check the progress of a muscle tear recovery and determine when it's safe for the athlete to return to sport. It can be used for detecting early stage injuries. So diagnostic ultrasound can help detect early stage injuries such as tendinopathy or inflammation within the muscle, which may not yet be causing any symptoms. Now, this allows the sports therapist to intervene early with preventive or corrective measures. For example, detecting a patellar tendinopathy in a runner before the injury becomes severe, allowing for early treatment and modification of training. So let's look at its relevance within sports therapy. You can look at an injured site immediately and give a clinical impression. So sports therapists often work in fast-paced environments. So diagnostic ultrasound provides instant results, allowing therapists to make quick decisions about the best course of action. There's no need to wait for MRIs or X-ray results, which can be crucial when deciding if an athlete can return to play or needs further treatment. Diagnostic ultrasound is non-invasive and generally less expensive than an MRI or CT scan, making it more of an accessible option for athletes and clinics. This allows therapists to monitor injuries regularly without the high costs associated with other imaging techniques. Now, diagnostic ultrasound machines are portable, allowing sports therapists to perform on-site imaging. This can be particularly useful during competitions or training sessions where an immediate assessment is required. For sports therapists, becoming skilled in the use of diagnostic ultrasound enhances their ability to provide comprehensive care. It gives them another tool to accurately diagnose or give a clear clinical impression, monitor and treat injuries, adding an extra layer of expertise to their practice.